Manual blood pressure physiology. Blood pressure is the measure of the pressure that the circulating blood exerts on the arterial walls. It rises and falls with systolic contraction and diastolic relaxation of the ventricles. Blood pressure can also depend on vessel resistance, as the vessels that are narrow or constricted have a higher resistance, compared to vessels that are wider or dilated, as they have a lower pressure gradient. When the left ventricle ejects blood into the aorta, the aortic pressure begins to rise, where the maximum aortic pressure following ejection is known as the systolic pressure. Whereas when the ventricle is relaxing and refilling, the pressure in the aorta falls. The lowest pressure is the aorta, which occurs prior to the ventricle ejecting blood into the aorta, known as diastolic pressure. Choric cough sounds are produced when the cuff pressure is between systolic and diastolic pressures due to the artery collapsing and then reopening with each heartbeat. Phase 1 is the first sound heard when the cuff pressure is released. This provides the systolic pressure reading. Phase 2 provides swishing sounds as the blood flows through the blood vessels as the cuff is deflated. Phase 3 provide intense thumping sounds that are softer than Phase 1, as the blood flows through the artery, but the cuff pressure is still inflated to occlude the flow during diastole. Phase 4 provides softer and muffled sounds as the cuff pressure is released. The change from thump in Phase 3 to the muffled sound in Phase 4 is the first diastolic reading. Phase 5 provides silence when the cuff pressure is released enough to allow normal blood flow, which is known as the second diastolic reading. Taking a manual blood pressure. After gaining consent, get the patient to place their arm in a rested position near the level of the heart. Ensure cuff size is appropriate, where it should be wide enough to cover 40 to 80% of the distance from the elbow to the patient's shoulder. Attach the cuff to the patient's arm, aligning the cuff marker with the patient's brachial artery. Ensure the valve on the blood pressure cuff is closed. Palpate the patient's radial pulse, located at the radial side of the wrist. Inflate the blood pressure cuff until you can no longer feel the patient's radial pulse. Note the reading on the sphygmomanometer at the point at which the radial pulse becomes impalpable. This reading is an approximate estimate of the patient's systolic blood pressure. Deflate the cuff. Close the valve on the blood pressure cuff. Palpate the brachial artery to locate where you will place stethoscope. Then position the diaphragm of your stethoscope over the brachial artery. Reinflate the cuff 20 to 30 above the systolic blood pressure you estimated prior. Continue to deflate the cuff. If the patient's blood pressure is outside of the normal range, you should repeat the assessment on the same arm after a few minutes. Subscribe to the channel for more.